Hi, I'm Julia Kearney, and I'm presenting the E and F portions of the bundle. So, E is early mobility, and F is family engagement. And my subtitle is Let's Get Moving on the Research. So, no disclosures. As I was thinking about these two components of the bundle, made me think that this is where the scope of the bundle gets a little bigger. Thinking about who is the patient, who is caring for them, how are they experiencing their illness and the PICU, and who can help get the patient better and prevent delirium. Okay, so the E, early mobility, correlates with the immobilization within the eye of brain maps. And the definition of early mobility in the research is the age appropriate and developmentally appropriate physical exercise that is performed within 72 hours of hospitalization or admission to PICU, and it includes vented patients. It has been found to be safe and feasible initially in adults and now also in pediatrics, and usually includes things like bedside transfers to the chair, to the wheelchair, to the commode, standing at the bedside, and gait training or retraining after critical illness or surgery. There are risks to immobility, which are profound muscle weakness for each day that the patient is intubated in bed, pressure ulcers, and venous thromboembolism. And the benefits are reduced length of stay in the hospital, approximately 2 days, reduced length of stay in the PICU, on average 4 days, reduced mechanical ventilation, which 3/4 of a day may not sound like much, but in cost savings and decreased morbidity is improved in-hospital mobility, decreased delirium, and improved satisfaction in the children's activities of daily living. So the real nuts and bolts of how people do this is really wonderfully captured in a video made by the PICU Up program at Johns Hopkins. I recommend everybody watch it. There's like 1 minute that if we had time, I would show you, but it really emphasizes the multidisciplinary aspect of this, the way families are involved, and has some wonderful photos and videos of kids and teens doing it together. And when you're going back to engage your stakeholders and try to implement these things at your institution, there's nothing like these videos to really show people how it is done. So there are some patients that are more at risk, and those are the patients that should be prioritized for the rehab resources if you're limited and are not able to provide the same kind of resources to every patient. So younger, higher baseline functioning or baseline disability, and then presence of ET tubes, and some other risk factors. So where the field of research is at for early mobility is really looking at now at dose of activity and duration of activity in order to maximize the outcomes, and really calling for a consistent set of core outcomes in this whole field of A to H liberation studies. Like, for instance, in a recent scoping review on early mobilization, they didn't even include delirium as an outcome measure in 21 of the 25 studies. And probably some of those institutions were already doing screening. They just didn't think to add it to their early mobilization program outcomes. So really thinking about the whole pathway and including standardized developmentally appropriate measures, which of course we have for delirium. So for family engagement, it comes up here in the atmosphere part of the brain maps, but I think also, as you're going to see, family engagement involves a lot of these steps. So we can really engage families to do many things and partner with staff on many parts of the patient's care. So the definition is actually, that's actually where the field is at right now. They've kind of settled on a definition of family engagement, which looks like a mutually beneficial partnership of families with the healthcare team. And it emphasizes the systemic part that has to happen to foster inclusion. So the policies and procedures that need to be engaged to foster inclusion of families. And it comes out of a couple of different types of work, but they're, really the term right now is family engagement. That's what we should be using. A recent scoping review on family engagement research included 247 studies, all methods of quantitative, qualitative, and 24 intervention studies. And of those, 14 were NICU, which, as you know, is a very challenging setting for families to be engaged, and 10 were in the PICU. So if we just look at the PICU studies, and there was actually one of those that was on the Gen Peds floor, but these are mostly studies that just implemented a family-centered rounds intervention and considered that the intervention, and then looked at family engagement outcomes. And there were a few other various types of interventions that were done like at single institutions. So this scoping review looked at all of these different outcomes and the different types of data that was collected, and tried to categorize the practices that are effective in engaging families in care. And they came up with these like 4 buckets, and then classified the individual interventions as like belonging to some of these different buckets. And they also classified them as based on more passive engagement of families or more active engagement of families. And the active ones are here in italics. So one bucket is increasing parent and caregiver involvement in the actual hands-on care, supporting parent decision-making and understanding of their child's care, developing a partnership, and modifying organizational design, infrastructure, philosophy. So like culture change and the systemic components. And there really were like so many different kinds of outcomes that they use. There is not like an agreed upon set of outcomes that measure family engagement. So that's really the issue with this research. There were like 49 different factors, and they weren't standardized. And so that's what really needs to be done. And they really did not engage families in study design or intervention design. And so that's also a very important piece of making this literature more impactful. So in conclusion, both early mobility and family engagement research needs standardization of core outcomes and development appropriate family-centered measures. The studies need to be grounded in theoretical frameworks and include stakeholders, and that our programs and culture change can move forward ahead of the research. So who is the patient? It's the child and their family. It's a family-centered view. Who cares for them? I'm just thinking about the rippling layers of people around the patient, right? Thinking about how they're experiencing their illness, and then really it's everybody's responsibility to help prevent delirium. So thank you very much.